Loveline is meant for an adult audience. Loveline may contain sexually oriented content. Listener discretion is advised. Adam Carolla and Dr. Drew. Loveline, coast to coast.
Hey, Loveline, I'm Adam Carolla. That is Dr. Marcel. Dr. Marcel is filling in for Dr. Bruce, who was filling in for Dr. Drew. No, Dr. Marcel is filling in for Dr. Bruce, and I'm sorry, Dr. Drew, I can't get Bruce out of my mind because I've seen him like 3 days in a row. Bruce and I went down to the drag races in Pomona.
Oh, now there's a male
Sunday.
bonding experience.
Oh, yeah. Yeah, he knows a lot about the motorsports, too, because he said, well, there's the funny cars, and then there's the long ones. He was referring to the dragsters or the rails as the long ones. There's a guy who spent a little too much time in biology class and not enough time at the street races in Van Nuys. Phone number, 1-800-LOVE-191. Fax number 310-840-4051. Dr. Drew will be back tomorrow night? No. Julie Serving, Dr. J will be filling in tomorrow night for Dr. Drew. Now, I'm really getting my doctors confused now. Who's in tomorrow night? We have a third one? I see. But who's the doctor who's in tomorrow night is what I'm asking. Doctor. I see. Okay, I got it.
You just need a wheel. Just spin it. Pick a doctor.
Someone has to hold down the fort around here. All right. Anyway, Dr. Marcel is board certified. He's a plastic surgeon. You're not an MD, are you?
Well, of course.
You are?
Yeah.
Well, I mean, an internist is what I meant.
No, not an internist, just a surgeon.
I'm sorry. Right. And you could you take out an appendix?
I probably still remember how.
Have you done it before?
Oh, yeah. No, most plastic surgeons do residencies before they go into plastic surgery, and I did mine in general surgery.
Right, so that's like it's a specialty, plastic surgery.
Right.
You don't begin medical school being a plastic surgeon.
No, it's a subspecialization.
Right, and I'll tell you what, Tonight what we can do is if you have questions about plastic surgery or, general medical questions we'll take. But I think we should focus on plastic surgery because that is Dr. Marcel's field of expertise. And he can answer any questions, breast reduction, breast augmentation. Did I mention breast augmentation?
Did you mention breast augmentation?
Breast augmentation and anything you're into, lipo, laser, removal, nose jobs, whatever it is. What's popular now?
The most popular procedures in the United States right now are liposuction and breast augmentation, 1-2.
And how's that lipo working? Have they worked out a few of the bugs in it? Were there ever bugs in it?
Well, when it first started out, they were using bigger tubes, and so a lot of people were getting rippling and divoting under the skin and all. But now we've gone to using smaller hollow metal tubes. Plus, we're also pumping in a bunch of salt water with adrenaline called a tumescent technique to make the fat removal less bloody, so you're taking out more fat and less blood.
Right. And, something I didn't know, although I never really thought about it too much, is I always assumed when you remove the fat that the fat would then eventually come back. But you're removing the fat cells?
Right. You're removing the fat cells, and so if you keep your weight fairly stable, the fat will never come back in the area from where you removed it. If you gain weight after the procedure, you'll tend to gain it in a little different distribution.
Right.
Say you did it, say as a guy, I did it, I had it done to myself about 6-7 years ago on my love handles.
Right.
And I weigh about 10 pounds more now than I did then, but I just have a little bit more generalized distribution. I don't have the love handles anymore.
Right. So you're saying, like, what lipo would be for is if you're a person that was in relatively decent shape, you had fat deposits, like let's say the love handles, and it wouldn't go away.
Right.
No matter how much exercise you did, that's where you stored your fat.
Yeah.
And you couldn't really make a dent on that.
It's diet resistant.
And that's true, right?
There are areas in men and women that are notoriously diet resistant. In women, it's certainly parts of their abdomen and their thighs, and in men, it's your abdomen and love handles.
And what about, do you ever do lipo on the face, like a double chin?
You can. You have to be a little careful there because if you take too much out, then you can get some irregularities that are seen under the skin because the skin there is not too thick.
Right.
And if it's a lot of fat under the chin, then you might get some skin sag.
Mm-hmm.
Depends on how old the person is.
Right, because the skin has lost its elastin and will not snap back.
Right, but not everybody uses liposuction that's tried diet and exercise. Some people use it to kind of jumpstart them into a better thing. everyone that's tried to diet, you're real good for a week or two, and you lose a quarter pound, and you say, oh, screw, and you're depressed, and so you go back off the wagon. I have a lot of patients that come, and they use this as kind of a motivational tool.
And how much is like a love handle liposuction?
How much money-wise?
Yeah.
It would depend on if you did it under local anesthesia, you did it under general. Being a surgeon with a surgeon's background, I prefer having the people asleep because it's just easier for me to work without having to worry if they're feeling anything.
And it's easier to get at their wallet when they're out.
Yeah.
The pants are in the dressing room. You have your staff combing through their pants.
Well, yeah, and that's when I can have Sancho, my assistant, do the actual procedure.
Yeah.
I can just sit back and count the money.
Right, you can actually go rifle through their underpants.
Right.
Well, Sancho,
exactly.
the day labor you picked up on the way in, can do the work. All right. So no, but how much is something like that?
Depending upon the number of areas and how long you think it's going to take, it can run anywhere from $2,500 on up.
Really, I'm surprised because I figured it'd be a little bit cheaper than that. It doesn't seem as involved as some of the other procedures.
Right. No, not really. I mean, by the time you factor in the operating room and the surgeon's fees, and if there is an anesthesia fee, it starts right up $2,500 and up.
Local being less than general, right?
Right.
All right. Let's hop on the phones again. Dr. Marcel is a board-certified plastic surgeon. If you have any questions of that nature tonight, now would be a good time to call. Nick? Nick?
Hello?
Yes, Nick. What's up?
Ooh.
Hey, what's up?
You're 17. Go ahead.
First of all, I just want to say, Adam, you're really awesome. And,
Thank you.
I was wondering when you're going to have that guest, Dr. Drew, back on.
The guest?
Ann, hold on. Ann says she booked, she's holding the note up. She said she booked Drew for Wednesday, Thursday this week? Okay. Dr. Drew, is it?
Yeah.
Yeah, Drew. I don't know his last name, but he should be coming in Wednesday, Thursday
Is he any good?
This week. As I recall.
He hasn't confirmed yet.
Oh, he hasn't confirmed. Ann says he hasn't confirmed. She doesn't want me to talk about it. She's still trying to get in touch with his publicist. We'll keep our fingers crossed, and we'll see if Drew can't make a guest appearance Wednesday, Thursday night on Loveline.
All right. My question is, like a few weeks
Then, of course, he'll give some dates out where he's going to be around the country instead of here.
All right.
All right.
A few weeks ago, I was going down on my girlfriend, and, I kind of threw up, not directly, in her vagina, but around there.
Sure.
And now she says she has, kind of a rash.
Yeah. Yeah, it's considered, I don't know what country you're from, but it's considered bad etiquette in the United States to vomit on one's vagina.
Yeah, I'm African, so.
Oh, I see. So it's good where you're from?
Yeah.
I see. And you didn't throw up in the vagina as if it was one of those air sickness sacks in a coach, but you threw up
Around it.
Around it.
Yeah.
Nice. Like she just, her vagina had entered some kind of pie eating contest or something. Yeah, and now she has a rash.
Yeah.
What do you think about that, Marcel?
Well, I kind of doubt that it's directly related to the puking event there, unless he had pretty acidic stomach contents.
Well, they're
So
usually
it's a chemical burn, maybe.
Right, but it wouldn't be any infection caused by whatever's in there.
No.
All right, but it is a sensitive area around there. But again, this is just the skin around the vagina, right?
Yeah.
All right. Well, maybe it's more of an emotional thing.
All right.
She may just have a little dermatitis or a little bit of irritation of the skin from just sexual contact, not necessarily related to him blowing chow on her there. But
Hey,
she'll
Nick,
probably still get it checked.
why did you do that?
Why did I throw up?
Yeah,
I don't know. It was just my first time.
I see.
Yeah.
So-
It'll get better.
All right.
Yeah, you'll be fine.
All right. Thanks.
All right, there, buddy.
Bye.
All right. That's
It's an attractive picture.
yeah, it is, and it's got to leave a scar with a woman.
Yeah.
I mean, a woman is not soon going to forget that. All right, let's pile through some of these calls. Melody,
Hi.
you're 26.
Yeah.
What's up?
I'm 26. How we were raised, very religious background, and I never, I was raised like a tomboy kind of, and I wasn't really into guys up until 19, 20 years old. And then the guys around here, I'm still a virgin, is pretty much what I'm trying to say. And I've never, ever had, a sexual desire towards anybody.
Yeah.
And now I've been not seeing dating or anything, but just, it's a guy at work, and he really likes me. And I like him, his personality and everything about him, but there's no tingles, nothing like that. But
Yeah,
I do
but
like him.
You don't get your cookie flipped very easily, though, do you?
No,
What's the farthest you've got with a guy?
not far at all.
Like what base?
Kissing.
That's it?
That's it.
Did you enjoy it?
I felt naughty, like bad. Like I was just doing it with him to see if I was okay. Like if I could do
Well,
it.
how long ago was this?
I was 22.
22, and that was your first and only kiss.
Yeah.
What's up?
I'm hoping you can, like...
Well, all right, let's do a little exploration. Are you religious?
No. My family background is Islamic, but we never, like, went to the mosque or anything like that. Like, no female circumcision with us or anything like that.
I see. And anybody ever do anything to you?
Physically, yes. Like, sexually, never. But physically, like, I was really abusing my dad and my older brother.
They beat on you?
Really bad.
Oh, really bad?
Yeah.
Well, there you go. That's it.
There's a bit of a legacy there.
But I don't, like, when I think of it, like, I don't, like, oh, like, I'm ruined, I'm never, like, I'm looking forward to hopefully having a relationship and all
Well,
this.
sure.
Like,
Let's wait till we're in our 40s. Let's not get too hasty here. What is that, how's that hymen of yours? That thing's got to be like an old baseball now. I mean, that's like an old mitt from the turn of the century, the one Shoeless Joe played with. Do you still have a hymen?
Yeah, I guess I do.
Were you brought up to think that sex was bad?
Yeah, and like the only guys I was ever around pretty much like were my kind, like our ethnic background, and
What is your ethnic background?
we're Bosnian.
Uh-huh. Yeah,
And
that's a big mess over there. It's tough to be a chick in that part of the world.
I was born and raised here though.
I know, but guess who born and raised you? Johnny Bosnian and his a-hole brother. Listen, your dad beat on you. It made you feel like a second-class citizen.
Definitely, yeah.
Yes,
definitely.
yes. Now you're freaked out. Are you out of the house?
Yeah, this past year.
Good. You got out too late, though.
Yeah.
All right. Now,
Well, I was hoping, like, I don't know, because we have a big family, and I was hoping, like, whatever, like, the Prince Charming would come and, like, it could be, leave the house in an honorable way where I can just marry someone.
well, that's the way. It's fine to move out of the house without getting married. Jesus, talk about honorable. You're 26. You're still a virgin. You've barely been to first base.
You need to date and just meet a lot of different guys and try to find somebody that...
Not to cut you off, but what's killing me is I really like this guy.
But you feel nothing for him.
Yeah.
Well, yeah, but you're not capable of feeling anything for anybody right now. I mean,
Like
physically, sexually. All right, but let me say something to you and all the other folks that are listening to this show. It's important in life to go against your grain once in a while. That's what emotional growth is about. If you just did whatever you wanted to do all the time, you wouldn't get anywhere. You'd experience zero growth emotionally. And I know sex is supposed to be a natural thing, but there's a lot of things that are supposed to be natural for a lot of people that aren't for a lot of people.
Right.
Depending on how you're... Love is supposed to be a natural thing, but if you grew up with an abusive dad or abusive mom or alcoholics or whatever, love, intimacy, it's going to be something you have a hard time with, and it's going to be something that you're going to have to maybe even sort of discipline yourself to do. Now, once you get the ball rolling, it's going to be okay. So if she doesn't experience anything for this guy, fine. Push yourself.
Right.
Go out with him anyway. If you go on a couple of dates and it didn't feel that great, so what? Go on another one. You have to force yourself to start living. You have to kickstart your life. Once you get it rolling, that'll be it. And I give that hymen a week after you get rolling. It'll be gone. Oh, these a-hole dads. Steve, I like when the brother gets into the act, too.
Oh, yeah.
Who beats your dad and brother?
Who loves you better than your own family?
Oh, yeah. I bet that brother's a wonderful father and husband to some very lucky woman right now. Steve?
Hey, Adam, what is that, like 7 months on your pristine penis?
That's right. Doc, that's when Marcel was here last, when he checked my pristine penis.
That's why I mentioned
Is
it.
it still pristine?
Almost no mileage since you
Really?
saw it last. Yeah. That I haven't inflicted myself. What's up, Steve?
All right, first off, I got a present for you.
I smell a fart coming up.
There we are.
Yeah. I'm Uri Geller, everybody. Thank you, Steve.
You're welcome.
Was that real?
Yeah, it was.
Nice.
Kind of wet, but
Yeah, no, that's fine.
Sweet.
hey. Yeah, I'm not real overweight. I'm about 6'2" and maybe 215, and I'm kind of built, but it's just my pecs haven't really formed. They're kind of floppy, and I just wanted to know if I could get some sort of like breast reduction surgery at all.
And you're 16?
If that was okay for guys to do, or
Yeah, well, it's not so much like a real breast reduction, but if you've got too much development in that area, it can be something related to what's called gynecomastia, which is excessive breast tissue development in men. It's fairly common around the time of puberty in young boys, and in some men it doesn't go away. It's like a temporary hormonal glitch that never then quite goes away so that the breast tissue stays developed. The only way you can get rid of that is by having that surgically removed.
For some guys, well, for all guys, muscles kind of develop at different times. Do you know what I'm saying?
Right.
Wouldn't you say the chest is sort of one of the last ones?
Yeah.
Meaning like your arms and your legs seem to develop faster than a guy's chest.
Yeah.
And maybe you ought to give it a couple of years, see where it turns out.
At 16, I wouldn't tell him to go have surgery, but if it's to the point where it's really a deterrent for him, he's not leaving the house with 2-3 T-shirts on, he won't go to the gym and stuff, you know, it's probably something he should at least be evaluated for by a plastic surgeon.
Right.
Because those self-esteem issues can run pretty deep. This is a kind of a critical young age.
Yeah, and a lot of guys have this gynecomastia. I mean, I've been hearing more and more about it recently, and for a guy, that's a serious bummer.
Yeah, and you know, it can be from a lot of reasons. Most of the time, you don't really find a cause. That's why it's called idiopathic.
Right.
But sometimes it's related to medications you're on. It can be related to smoking a lot of dope.
Right.
For all you chronic pot smokers out there who's watching your boobs get bigger.
Yeah, but, I mean, could there be anything better if you're a chronic dope smoker? I mean, just sit home and feel
Growing
yourself
boobs?
up?
Yeah.
Well, yeah, I could have done with some boobs in high school. Would have been nice to see what they felt like. All right, let's see. Bianca?
Yeah.
What's up? You're 20.
Okay. I'm having issues getting over my ex-boyfriend. We've been on and off for about 4 years, and he was a total jerk, and I don't understand how come I'm just so into this guy, and I really, really feel that I need to get out of it, and I'm not doing so well. So I wanted to know if there's a possibility I could get somehow hypnotized so that I can, like, forget about him.
Yeah, that's kind of worthless. What are you, 20?
Yeah.
How long have you been with him?
About 4 years.
Yeah, you can't get, are you broken up now?
Yeah, we're broken up now, but I want to totally stay away. I don't want him.
All right, well, good, don't do it.
Well, it's easier said than done.
Why?
Well, because he's just like...
If he's such a jerk, why do you want him back in your life?
Like, he wasn't such a jerk, like, all the time, but...
But enough.
It's best that I stay away, and it's like I can't. He's, like, addicting.
Yeah, because your dad's a jackass?
No, my dad's not a jackass.
Really?
No.
Then why are you attracted to an idiot if your dad's not an idiot?
Honestly, I don't know. I don't know what's wrong with me.
Well, what kind of guy is your dad, just for fun?
Oh, my dad's a really good guy.
Really?
Yeah, a really great guy, he is.
Is he dead?
Yeah, he's you know, funny. He's, like, the smartest man I've ever met. You know, he loves me a lot. He supports me in everything I do.
Wait a minute. From the grave?
For what?
Was he dead or alive?
No, he's alive. He's very much alive.
I see. I thought you said he was dead.
He, like, told me. He warned me. He said that he didn't want me to go through this relationship with my ex and then be so scarred that I won't recognize love when it really comes for me.
Yeah.
And I really want to get out of this pattern so I don't end up getting so scarred like that.
Well, how's your mom?
She's cool.
Yeah, you don't like her?
No, I love my mom.
You're good. You love your mom, you love your dad.
Yeah.
No alcoholism in the family?
No, they're great people.
Yeah.
My mom's a good, you know, Catholic. She raised me to be Catholic.
Aha. What kind of truck does your dad drive?
How did you know my dad drives a truck?
Because I smelt the guy who was on the road.
Oh, no. Oh, my goodness. No, not. He drives a Ford F-150. No, not that kind of truck. My dad's at home a lot.
I see. What's he do? Construction?
No. He works at North American Chemical Company.
Aha! A chemist.
No, he's not a chemist. He's a coal barn operator.
He's a what?
Coal barn operator. You know, coal is in, like, fossil fuels.
Right.
Yeah.
What was the second word?
Barn. Coal barn operator.
Coal barn.
Yeah.
Oh, sure. Yeah, I remember as a kid we used to go play in the coal barn.
What?
There was a shop at the mall called the Coal Barn.
Okay.
One of my favorite watering holes was named after a coal barn. I see. All right, so he works at the coal barn.
Yeah.
All right. So you love your parents very much.
Oh, I love them.
And no trauma growing up. Nobody was...
just the only trauma that came about was when they really wanted me to, you know, break up with my boyfriend, and I really tried. I tried to stay away from him, but...
All right.
Do you like yourself? I mean, do you have problems with you don't like the way you look, or do you think you're not pretty, or...
Yeah.
So self-esteem issues?
I guess so, yeah.
What's up? Were you overweight at some point?
Oh, when I was a little kid, yeah, I was a little chunky.
All right. Well, now we're kind of getting somewhere. See, you don't feel that good about yourself, and you got a guy who's beating up on you.
Oh, wait, not physically.
All right, but emotionally.
Okay,
And you're
okay.
going back for more.
Yeah,
I'm
trying to stay away, really.
Yeah. All right.
It's
and
not even a question of trying to stay away.
just stay away. It's been some time now, right? You don't think you can find another guy?
I hope so.
I bet you could. Well, you certainly can find another a-hole. I mean, that's easy.
Yeah.
Where are you calling from, Northridge?
Yes, sir.
That place is packed with a-holes.
It is. They're
Yeah,
bald, though.
Yeah, it's like the a-hole capital of the world, Northridge. I used to work out that way. There's more a-holes per city block in Northridge than only rivaled by Chatsworth, which is right next door. But sometimes some of the a-holes from Chatsworth, blow across the border into Northridge. That's
Yeah,
a
well,
lovely, lovely town, especially during the summer.
I've had offers, and it's like I'm not, interested.
All right, listen. Bianca, you're 20. You're a big girl now. I don't feel sorry for you. No one sexually abused you. No one physically abused you. Your dad's a nice guy.
Yeah.
He worked at the old coal barn. So that's it. You're out. Stay out. Now it's time to take a stand. You're a woman now. Be strong. Don't take that weak path. All right? You know what you're doing. You were fat 5 years ago. Big deal. Jesus, that stuff, that sticks, though.
Yeah.
You take somebody who was overweight in, junior high and high school, and I don't give a rat's ass what they look like as an adult. I don't care if they're the best-looking physical specimen in the United States. They still look at themselves as that screwed-up, fat 8th grader.
Yeah, scars run deep.
Yeah, that's the kind of chick you can score with. That's what I'm looking for. All right, we'll take ourselves a break. Dr. Marcel filling in for Dr. Drew tonight. If you have questions that have to do with plastic surgery, he's the expert. Tonight's the night to call. We'll be back. Yeah, it's good radio where I chug a half gallon of water right before the show starts. It is Loveline. I'm Adam Carolla. That is Dr. Marcel. Dr. Marcel is filling in for Dr. Drew. Dr. Drew, I hear, and again, don't write this in pen, but just pencil it in. Maybe in Wednesday and Thursday this week. So Ann says she has to confirm it with this publicist. But we're looking forward to booking Dr. Drew on the show later in this week. So that's something we can all look forward to. Dr. Marcel is a board-certified plastic surgeon. He has done it all. And how many years' experience do you have, Marcel?
11 years now.
11 years. And Bruce, I'm sorry, still I'm Bruce. Drew really swears by your work. You guys were roommates, right?
Yeah. Roommates our senior year in medical school.
Why not junior year? How'd you guys meet?
In class. I transferred in to SC and just met in a class. He had an opening in his condo that his parents had set him up in there.
That bastard.
Yeah, no, he had it good.
Oh, son of a bitch. He always cries the blues to me. Telling me about driving a vintage Firebird wasn't cool back in 79.
Yeah.
I'm like, listen, looking like Dan Tana in 79 wasn't cool? How dare you insult me while I was on a Enduro I bought out of the recycler. All right. Phone number 1-800-LVE-191. So especially tonight, we're looking forward to your questions that have to do with plastic surgery. Let's talk to Lisa. Lisa?
Hello.
22. What's up?
Well, I have a question about on Friday. I'm supposed to get a breast augmentation,
Okay.
but it's through transumbilically, and
The famous tuba.
Through the ass. Is that what that means?
through my belly button.
Right up through the belly button, out the ass, and back in the ass, and right to the chest.
Uh-huh.
Now, how does that work? How can you get something the right size up in there, or do they inflate it once it's in you?
It's inflated once it's in. It's put in deflated. It's rolled up like a taco, if you want, and you insert it through the tube or an endoscope.
Uh-huh. So they actually feed the endoscope right up through the navel. Right to where they want it. I'm guessing that's over the muscle?
Well, that's just it. Do you know if your implants are going to be on top of the muscle or under the muscle?
They're going to be under the muscle.
Okay. Saline?
Yes.
Round?
Smooth, yes.
Smooth?
What's smooth? Oh, as opposed to
the roughened ones, the textured ones?
Yeah.
What's up with those textured ones?
Well, the textured ones are just designed to decrease the chance that the breast gets hard. They found in some studies that texturing the implants decreases the chance that you get excessive scar formation around the implant.
Well, why not go with the textured ones all the time then?
Well, depending upon how much tissue you have to drape over it, sometimes the textured implants show a little bit more rippling.
I see.
You get some traction rippling.
All right, so they do this endoscope up under the muscle and release this thing under the muscle?
Yeah.
Bruce got Bruce. Marcel's got a puss on. I know, it's bad.
Well, Lisa, I'll tell you, there's, in plastic surgery, there's certainly more than one way of doing a procedure.
Yeah.
And right now in plastic surgery, there's two camps of surgeons. One camp that thinks that it's more difficult to do a real precise dissection through an endoscope and do a real, good job defining your inframammary crease and all. And I happen to belong to that group. I personally don't do it through the belly button. That's just my choice. There's a very, very steep learning curve to that procedure, so I would make sure that whoever is offering to do it to you has done it a lot of times and can show you some really good pre- and post-op pictures of patients that have gotten the implants under the muscle, by him or her, and then even asked to talk to some of them. Because, I'm not going to fault the guy if he can get a reproducible result through it. I just think it's more difficult, and I'll tell you the regular scars that you get from doing it either through the nipple or under the breast or even in the armpit are certainly not bad, and sometimes they're almost invisible. So to me, it's like an operation looking for a reason to exist.
Because I'm getting it done by the surgeon who he said that he actually developed it. And
You know something? Let me just give you one bit of advice. I'm going to give everyone that's listening to this show one big bit of advice about plastic surgery. Anyone that says they're the only one that knows how to do it, or that the ones that developed it, they're blowing smoke up your ass most of the time. Ask to show the scientific paper that he, had published in Plastic and Reconstructive Surgery.
Okay.
That to me it sounds a bit arrogant.
Yeah, and he's like, all the tools are named after me. And
Oh, sweet Jesus.
so I was like, oh, and so I wasn't sure because I talked to a lot of other plastic surgeons, and almost every single one I talked to said, oh, I don't do that procedure because there's so much tissue to manipulate to get there.
Right, and I'm telling you right now, when you read your consent, there's going to be a big fat paragraph on there that says, in case we can't successfully complete the operation through the belly button, we'll then have to make the scar in the traditional location to salvage it.
Oh.
Yeah.
Are you freaking out? You're not high now, are you,
that's-
Lisa?
No.
That's called you having to convert the procedure.
All right, let me ask you this, Marcel. She has this set to go on Friday. Tomorrow's Tuesday.
Yes.
If you're in her now, you put the fear of God into her and her new boobs. All I'm saying is that maybe the guy's the greatest,
Right.
but maybe he's not.
Right.
What do you do if you're Lisa starting tomorrow?
I'd probably want to talk to her off the air.
You would.
Yeah, just to find out. I know pretty much a lot
some
of
names.
people. Yeah.
All right. Why don't we do that, Lisa?
Yes.
You want to hang out?
Yeah, I will.
All right. We'll put you on hold. Hey, Lauren, put Lisa on hold. Marcel's going to talk to her off the air because she wants to find out whether he knows a quack
No,
or
I
not.
mean, the other thing you can find out is just, ask in your local community, find out, if the plastic surgeon or whoever the surgeon is that's offering to do your surgery is credentialed at the hospital, if he's got privileges to do the procedures that he's or she is doing in his surgery center at the hospital.
I see.
If you have your own little surgery center, I could do neurosurgery in a surgery center if I could get people to allow me to drill holes in their head.
Right.
But I can't get privileges as a neurosurgeon at a hospital because I'm not trained in it.
Let me ask Lisa, how much is he charging?
$6,000.
$6,000.
I'm not charging enough.
Yeah, no, you're charging plenty. Don't worry. Just because there's bigger a-holes than you doesn't mean you're not doing your job. $6,000. I guess it's then more through the belly button, right?
Yeah, I'm sure it is because it's a little more difficult to section.
And this is a newer thing, right? Relatively newer?
Relatively newer.
But it's not the breakthrough that they would make it out to be.
No, of course not.
And is scarring-wise, what's your best bet? I mean, if you're going through a traditional route, armpit?
Actually, I like around the nipple. I think that gives
Why?
It gives a real hairline scar that 9 times out of 10 is practically unseeable.
Much better than the one underneath the breast.
Right, much.
Okay. And what's the easiest shot you have with the implant? Underneath the breast scar?
That's a little more direct approach, yeah. But,
And
so
seems like the armpit would be a pretty good place to do
the
it.
armpit is good, but you know something, especially in Southern California or in places where you're wearing a lot of sleeveless stuff, just the thought that you have an incision up there and maybe that if you put your arms up, you're lying on the beach or something, people could see the scar.
Right. Yeah. Yeah, the armpit one you can see without even actually taking your top off. Vanessa,
Hi.
you're 28. What's up?
I wanted to ask a couple questions for Dr. Marcel. If you have liposuction around your waist area, what's the most they can take off around there? And can you have children, can you bear children after you have it around the stomach area?
Yeah.
And also another question, just listening to the girl before, my chest is really nice right now, but eventually I know they are going to drop, but I don't want to get implants. Is there anything that can be done to lip them, later on when they fall after childbirth? Or
Sure, you can do what's called a mastopexy or breast lift. That involves snugging up the skin envelope, because the shape of your breast is determined by what fills it out and then the skin envelope.
I thought you said there wasn't a lift at one point when we were discussing this.
No, you can do lift. It just involves more scarring, and that's the trade-off for a lift.
Will the lift push everything to the top? That kind of lift?
It will lift it up, yeah.
No, it shoves them to the side. And where would the scar for the lift be? Up where you would assume it would be?
Well,
up here?
Yeah, but see, the scar is designed so that eventually it's closed around the nipple. So the resulting scar is going to be around the nipple, and then in some cases down the front of the breast and in the crease, kind of like an anchor, an upside-down T.
So it's like a breast reduction.
Correct.
But you're not doing a breast
All
reduction.
you're doing is taking skin.
Oh, so you're tightening the skin from down here.
Exactly.
You're not lifting it up.
No.
So it's like you're squeezing on toothpaste.
Exactly.
Not pulling the blinds.
Right. And
I should work for you.
I know.
Listen, I'm no surgeon. I have almost no training and almost pretty much an 8th grade education. But let me talk to you about what's going on.
You've got hand-eye coordination,
That's
man.
right.
That's what you need.
Let me see those breasts, honey.
Now, and then sometimes if you don't need...
It's $100.
If you don't need too much of a lift...
Cash, please.
It's you can make the scar just around the nipple.
About the waist, what's the most you can take off around the waist area?
Well, the field of liposuction got a couple of black eyes earlier in the late 90s when...
Hold on, they're letting black guys do this now?
Yeah.
Oh, you said...
Oh, black eyes.
I'm sorry. I was misunderstood.
And, there were... Plastic surgery sometimes is a lot like the Wild West, and you want to be the biggest gunslinger, and guys brag about how much fat they could take out at a sitting. And unfortunately, some patients died as a result of too much being done at one sitting.
One doctor out here, I'm not going to say his name, but he says anywhere from 15 to 25 pounds he can take off just in that one.
Well, that's called maximum liposuction, and if anyone is offering to take off that much at one sitting, it probably should be done in a hospital setting with potentially an overnight stay. Right now, the American Society of Plastic Surgery, the recommended guidelines for safe outpatient liposuction on healthy patients is about 5 or 6 liters, which is about 2.5 to 3 of those 2-liter Pepsi or Coke
worth of fat or worth of just overall volume?
Fat.
Well, that seems like it'd be
about
12
10
pounds or something. No,
Yeah.
I'm saying 12.
Okay.
Wow, that seems like a lot of fat.
It can be.
Well, how much? Can you tell me, I'll show you my love handle, right?
Yeah.
Can you tell me, what that is?
Oh,
right
you?
there. Yeah, how much would that weigh
That's
there?
about 3 or 400 cc's on each side.
Well, what's that in poundage wise?
About a pound.
That's about a pound there?
Yeah. So about a pound on each side, maybe.
Yeah. And what'd you charge me for that?
For you, I'd do it just for the publicity.
Yeah, my ass. I went over there for a laser. You charged me $100, you son of a bitch.
I'd do it just for the pictures of you.
All right, we will take ourselves a little break. Dr. Marcel is here. He's a plastic surgeon. He's actually going to speak to Lisa off the air about her boob implants. When we come back, we'll talk to you and get more of your questions. Again, Marcel filling in for Dr. Drew tonight, and line up those plastic surgery questions after this. Hey, Loveline there, kiddies. Phone number 1-800-LOVE-191. Fax 310-840-4051. Dr. Marcel, the plastic surgeon with a heart and a pinky ring, is doing our show tonight. He's filling in for Dr. Drew. He just got off the phone with, I believe it was Lisa, was calling about that boob job via the navel. And Marcel may have known the surgeon that was doing it. Wanted to give him a quick check out over the phone. Did you know the guy? I don't want to get you into trouble, get him into trouble. Did you know the guy? Had you heard of him? Was it all right? Or
I'm not going to say anything
I
anymore.
see. Not a great sign. All right. So you told her to...
I just told her to, if she's being told one thing by 2 or 3 or 4 plastic surgeons, and then this one person is telling her something totally different, maybe she better go with safety in numbers.
Right. Well, people obviously have an idea. I mean, like I said, the breast implants via the navel. I'm a guy, and I'm thinking about getting it done. You know what I mean? It sounds pretty
great.
good. Sounds good, and it may be just a little too good to be true right now.
Maybe.
All right, let's continue on, and we'll talk to Alexis, who's 20. Alexis?
Hi, I have a problem with guys. Like, I'm afraid of them.
Yeah, why is that?
Because I have this boyfriend, and, like, he beat me, and, like, when I tried to leave him, he, like, chained me to a desk for 3 days, and, like, my family was really worried, and then they took me and they moved me to another state.
Really?
Yeah, and so, like...
What kind of desk? School desk? Roll top?
It was like an armoire.
Oh, well, that doesn't sound too bad.
Well, it was really heavy, and I couldn't get out.
I see. And he chained you.
It was a handcuff.
He cuffed you to the desk.
Yeah.
And then what did he do? Did he feed you?
Yeah.
And did he let you, move around for an hour a day before he rechained you again?
Well, he just let me go to the bathroom, that's all.
And you slept there?
Yeah.
You stayed at night, you went to bed chained to a desk.
Armoire.
Armoire, sorry.
I really didn't have a choice.
No, I'm not saying it was your fault. I'm just trying to figure out if you're literally handcuffed to this thing.
Literally handcuffed to the desk the whole time.
And when you got up to, like, go to the bathroom, you didn't want to make a break for it?
There wasn't a way to make a break for it. There was no window in the bathroom.
I see. And then it was right back to the armoire.
Yeah.
That's called kidnapping.
Yeah, that's horrible. Now, did you call the cops?
Yeah.
And what did they do?
They couldn't find him.
And
He left when I left.
have they still not found him?
No.
Okay. And you moved to another state?
Yeah.
So he's out of your life.
Yeah. My parents paid for me to move. So, and I dropped my classes at Berkeley, so.
So because of a really bad experience now you don't trust other men?
Yeah, like I get terrified of them because, like, I was molested when I was 4. And
There
he
you
told
go.
Me, and, like, this guy that chained me to the desk, he's like, oh, you enjoyed it, didn't you, and stuff like that, and it just really screwed me up.
Now, the thing I can't figure out is it wasn't your dad who molested you.
Yeah, it was.
It was.
Mm-hmm.
But yet he paid for you to relocate later in life.
My stepdad. My real dad's dead.
I see. Oh, the guy who molested you.
Yeah.
Oh, good. How did he die?
He had a hepatitis.
Fantastic. So he was a junkie?
No, he had a tattoo done in the late 60s.
Oh, good. Well, anyway, I'm glad he's dead. Anyone who molests their daughter deserves to die. So your stepdad's a decent guy.
Yeah.
All right, but can you get anything from that? I mean, you see your stepdad's a decent guy. There's one guy out there.
Yeah, I guess. I just, like, I'm really afraid that it's going to be the same thing because I was raped when I was 19.
Right. By the same guy who chained you or another guy?
No, by my friend's dad.
Your friend's dad?
Yeah. I got sick at her house. I had food poisoning, and I stayed over the night, and, like, in the middle of the night, he was, like, touching me, and I threw up, and then, like, I went to go take a shower, and he raped me in the shower.
I see. Well, he could have been a doctor, and who are we to question his techniques? All right, so your life's been a disaster thus far.
Yeah.
Okay, but you understand there's a lot of guys out there. I mean, what about Drew and, I was going to say Marcel, but Bruce? I mean, there's a lot of real decent guys out there. You just have a little difficulty finding these guys, right?
Yeah, I just get panic attacks when, like, if there's a male nearby.
Have you gone into therapy?
Yeah, I'm in therapy right now, and, like, she hasn't gone into that yet. She's just still dealing with the whole dad thing.
Well, what about perhaps getting on some medication, going to a psychiatrist?
I mean, there's a lot of very good medication out there for panic attacks.
Yeah.
Mm-hmm.
Yeah. I mean, for someone who's been, I mean, basically what you probably have is like a post-traumatic stress disorder.
Yeah.
I mean, if you look at your dad having sex with you at 4, that's worse than Vietnam. It really is.
Yeah.
Unless you're a Vietnamese kid, in which case you're getting it, you're getting it from both ends now. You're in Vietnam.
Right.
And you're having sex with your dad. But, I mean, this is something that's may have changed your brain chemistry a little bit. And it's a good time for that because there's a lot of good medications out there that could help you.
Right. The current generation of serotonin uptake inhibitors and all have really revolutionized a lot of treating depression and anxiety and panic attacks. And if your therapist is a non-MD and is right now just helping you just talk about things, you may want to get a physician involved that's going to put you on something to help you out.
All right, so Alexis,
Yeah.
next time you talk to your therapist, why don't you ask them about medication and about talking to a psychiatrist or a physician who can get you on the medication, and then you can balance that with your actual sort of verbal recovery, which is talking to your therapist.
Okay.
All right. And take care of yourself.
Okay.
And listen, if you're attracted to a guy, I want you to run the other way.
Okay.
You understand?
Well, I'm attracted to you, so that's kind of scary.
Oh. All right.
Good thing you're in
Listen,
Austin.
I wouldn't, if I chained you to an armoire, I'd give you some 120 sandpaper and a staining brush and put you to work. I wouldn't just leave you there for 72 hours.
Okay.
All right. Take care of yourself.
All right, bye-bye.
All right. Oh, boy. That's fantastic. The
Yeah.
molestation, the gift that never stops giving.
Just awful.
Yeah. Now, listen, you think I'm a bad guy that I'm happy your dad is dead?
No.
Good. That's what I love
No,
about
no,
you.
no.
Screw that Hippocratic oath.
That's right.
You're Jesse, you're 16. What's up?
Yeah, hi.
Hey.
Adam, I just want to say you are my ideal man.
Thank you.
Dang.
Yeah,
Feel
scary.
the love.
I know you probably don't hear this from a lot of girls, but I love the man show.
Oh, fantastic.
Okay, well, I have a very high sex drive, but every time I have an orgasm, it gives me cramps, like period cramps.
Mm-hmm. Who are you with when you have these orgasms?
Either with a guy or a girl or myself.
Oh, I thought you were going to say a goat or a monkey. So you really do the trifecta. You're bisexual.
Yeah.
All right. What's up with that? You a little chaotic?
Oh, I guess you could say that, yeah.
Yeah. You anyone screw with you growing up?
Oh, yeah.
Yeah. Yeah. I know the bis don't like me talking this way, but that's the fastest way to become bisexual. Have some weird uncle goose you when you're 5 or 6. Magically you become bisexual, even though it's your own choice.
Oh, well, I was never, like, sexually abused or anything, but
Yeah.
my parents are just both really messed up. My
Why?
whole family, actually.
What do they do to you?
Well, my dad and my mom were both drug addicts when I was little.
Mm-hmm.
My mom had a nervous breakdown when I was 9 because she took speed.
Right.
Sweet.
All right.
So then I went to stay with my grandma in Arizona, and
Well, that's enough to make you...
Yeah, that's enough to freak you out sexually. All right, so, hey, Jesse.
yeah.
Yeah, more issues, though, right?
Oh, yeah.
Yeah, well, what do you think, Marcel, what do you think the cramping is?
She might just have real powerful contractions. You know, vaginal spasm or contractions when she has an orgasm.
Is that true, Jesse?
Well, kind of, yeah.
Well, what I mean is if I laugh real hard, I can give myself a cramp. You know what I mean? I mean, if I do anything with a lot of gusto, I can give myself a cramp.
Well, no, like, I heard somewhere that, like, if you masturbate when you're on your period, you can, like, relieve cramps, but it just gives me worse cramps.
Have you gone to a gynecologist?
No.
Well, and you're sexually active.
Yeah.
Well, that's what you need to do.
Okay.
That's like tip number 1.
Yeah, you're gonna get pregnant too. Are you using any birth control?
No.
All right. Listen, goofball. You got to get to a gynecologist, get a pelvic exam. You're a big girl now. You're big enough to be sexually active with everyone. You might as well you got to get yourself checked out.
I had a couple appointments, but I just ended up not going.
All right. Well, as long as you made the appointment, that's the important part. So it's just like the dentist. You don't actually have to go. Just break a few appointments. That's fine.
Yeah, and then when the teeth rot out,
No problem.
No worry.
You can say you made the appointment.
When it burns when you pee, no problem.
Genius, Jesse. All right, baby. Go make another appointment and keep it, okay?
Okay.
And don't be stupid. You're going to get pregnant.
Or worse.
Or worse. All right?
Okay.
All right. Take care of yourself.
Okay.
All right. It is Loveline. I'm Adam Carolla. That is Dr. Marcel, plastic surgeon. If you have any questions for him tonight, feel free to call. We'll take a break. We'll be back. Loveline. I'm Adam Carolla. That is Dr. Marcel, who's filling in for Dr. Bruce, who's filling in for Dr. Drew, who swallowed the fly. And Dr. Drew, is how he pronounced it. Just goes by his first name, right? Just Dr. Drew. Dr. Drew will be in here, most likely, Wednesday, Thursday this week. Ann has been on the phone with his publicist during the week, and hopefully we have booked the great and elusive Dr. Drew. Is going to come on. He's going to plug some dates he's doing around the country, and then back to the Learjet and off to parts unknown. But kiddies, keep your fingers crossed. We're looking for Dr. Drew on Wednesday, possibly Thursday night. Anyway, I'm glad to have Dr. Marcel in here tonight because plastic surgery, I think anyone who's got a heartbeat or pulse is interested in some degree in their physicality, what they look like, their outward appearance, and that's why it's very interesting to have Dr. Marcel in here tonight who can answer all your questions about just that, plastic surgery. Let's talk to Elizabeth, who's 22. Elizabeth?
Hi, Dr. Daniels. I'm actually Dr. Marcel's patient. Dr. Daniels, Dr. Marcel, I don't know what you like to be called.
Right. Well, Daniels would be the last name, right?
Yeah.
You can call him Dr. Marcel for the sake of confusion.
Okay, Dr. Marcel. I had breast implants done about, I think it's been 8 months, has it been?
Yeah, something like that. This is not a setup call, Adam.
No, I know.
I don't want to...
She's sitting in
I never
Dr.
thought anyone would
Marcel's
get through.
Porsche right now on his cell phone.
Yeah.
All right, so he did a job on you.
Uh-huh, they turned out beautifully.
What size did he give you?
A large B. I actually want to go a C, but he said a large B would look better on me.
Really?
Mm-hmm.
Sometimes bigger's not necessarily better.
Yeah, but I think it would have looked a little better bigger.
Well,
we'll talk.
Why not a C? I mean, C doesn't sound too big. Does she have a small frame?
Yeah, real tiny gal.
Nice.
You know, and it all depends. I mean, breast surgery is a very popular surgery, and a lot of times getting people to understand the limitations of it on, what looks natural, what doesn't look natural, and implants, the same size implant on 3 different patients is going to look, you're going to get 3 different results. And sometimes if you don't have a lot of tissue to hide the implant, it's better to go a little smaller so you camouflage it better.
Right. So, Elizabeth, you didn't start off with much, right?
No, not really.
So, and when you don't start off with much, you can't try to go too far. It's going to look fake.
Right, but you know what? Some people can tell anyways. Like they said they can tell.
Well, when you are examined, especially with saline, certainly you can feel the implant.
Mm-hmm. No, they said they could with clothes.
Well,
really?
I mean, they can see it through the bra?
No, I mean, I don't know. They said because they look bigger for what my frame is.
Oh, well, listen, that's why you got to be glad you didn't go with the C. What about now? I've felt a saline implant and a silicone implant, and silicone feels better.
Yeah, in terms of pure aesthetics, there's no comparison. Molds better inside your body.
Right.
And actually those implants are once again available. They've been available since '97 on a restricted use at the moment. The FDA is doing I'm one of the investigators for the FDA, and we're doing an ongoing study on silicone gel implants and their safety.
Yeah.
And eventually, the manufacturers of the gel implants think that they'll come back into full use for routine cosmetic augmentation.
And how different will those silicone gel implants, new generation, be from the older ones?
The shell of the implant is a little thicker, so you're not getting as much what we call gel bleed. You'd get microscopic amounts of the gel that would go across the older implants.
Right.
The gel inside is a little thicker, so that when the implant does wear out, which all implants eventually do, the gel will tend to stay in the same area that it was put in.
What about the old stuff? I heard a lot of that was just trumped up.
Yeah.
A lot of lawyers getting involved. And much
they're
ado
the only
about
ones
nothing.
they're the only ones that made money.
Right. So, I mean, what you're saying is the whole silicone thing was a little bit of
hysteria. I mean, the National Science Panel 3 years ago reviewed 2,000 documents that were generated on silicone gel implants, and they could find no health-related risks.
Yes, that's what I love about this great litigious society of ours. Hey, Elizabeth?
Uh-huh.
All right, so what has this done? You get more dates, guys look at you, or
so much more attention.
a lot more tipping at the club?
I get a lot more attention. I'm actually looking for a job as a bartender now, so hopefully
I see.
I hope and tips.
And Marcel, did you get the local or did you get the general?
No, they all get general.
You were out?
Yeah.
And you recovered fine, and everything went great, huh?
Beautifully.
All right, baby.
I just wanted to tell him you did a great job, and just
God
wanted to
bless
say
you.
hi.
All right, my dear.
Take
Okay,
care.
bye-bye.
Yeah. See, they said advertising the penny saver wasn't a good idea, but look at all the business it's brought you. All right, just another satisfied customer. And Marcel doesn't satisfy too many women, but that was one of them right there. We will talk to Jack, who's 26. Jack?
Yes, I'm calling about my wife has inverted nipples, and she's talked to her doctors about it, just regular doctors, not a...
Right.
And she has heard that there's really nothing she can do about it.
Actually, that's not true. And depending upon why her nipples are inverted, depending upon if they can ever, some women, if they press on their breasts a certain way or they get a little aroused, sometimes their nipples will pop back out. It's a sign that most likely you could have it corrected surgically. And so there are a couple of procedures that have a pretty good track record for correcting inverted nipples.
What do you do? Just get them out, and then you get a pipe cleaner and go around them nice and tight and keep them out?
You know, Adam, you're getting pretty darn close there.
Well, listen, you can't argue with just good basic common sense. I mean, imagine you first got to coax them out, and then you got to keep them out.
That's right.
And the only way to keep them out is to sort of get something up against the base and tie it off a little bit.
You know, that is one of the techniques that a lot do of plastic surgeons use.
Did you put a stitch in there?
Yeah. You can sometimes...
I should be doing this.
I'm telling you.
My years of carpentry mixed with my my bedside manner.
Be sweet.
All right.
So there's also in some women they have naturally short breast ducts, and that causes traction on the nipple, pulling it in. And so one of the procedures is just freeing up those breast ducts and then putting in the stitch to keep things from falling back in. There's even a company that makes a little bit of a suction device, a little pump, and I don't know what company makes it, and that they claim at least over time will lengthen those ducts and allow the nipples to stay everted.
Well, we were also curious to see if these operations had any effect on breastfeeding.
Yeah, well, they can certainly, because anytime you're going to be messing with any breast ducts, you certainly could affect breastfeeding. So
how do you breastfeed with feast? How do you breastfeed with inverted nipples?
Well, some women it's very difficult, and some women when they do get pregnant, though, their nipples pop out because they're engorged.
Well, because
so
they're
have
done, like
that
turkey you put in the oven.
Exactly.
All right, so hey, Jack.
Yes.
Yeah, go talk to some plastic surgeons.
Yeah, but if she wants to have kids, if you haven't had kids yet and she wants to try breastfeeding, probably should hold off trying to correct that until after.
Right, man. Because if something goes wrong, you're ass out of luck. Amanda. You're 19. What's up?
I was calling. Sorry, I lost my voice a little. I had my breasts done, and I love them very, very much. But I want them a little bigger, and I was thinking about that the pill that came out, the ISIS thing.
Sure.
I was just calling. I wanted to know if it was safe to go with the breast implants and everything.
Sure. You take the ice. You take two bottles. You put them in a hefty bag. You crush them up, and you stuff them under your skin.
Under your bra.
And there you go.
No.
Now, what about any of these pills?
I've never seen a double-blind scientific study in a legitimate journal that has proven that any of them are really effective.
Right.
I mean, there's even a company that makes this breast vacuum pump.
Oh, yeah.
And it's like a brassiere. And it hooks on your breast, and you hook this vacuum up, and over time it stretches your breasts out and can increase your cup size, but it kind of makes them more droopy.
Yeah.
But they sell it as a non-surgical breast enlargement.
No, I got the penis version of that. Same company. It doesn't work. It just made my asshole bigger. It didn't make my penis longer. So maybe I wasn't using it right.
I think, Amanda, just save your money on the pills.
Well, because I already spent I spent a fair amount on the surgery, and I don't want to spend that much again.
Well, what size
really,
implants
really
did you
want
get?
Them bigger.
What size implants?
You're 19, baby. Relax there.
I know, but...
What do you do for a living?
I'm a cocktail.
You're a cocktail waitress?
Uh-huh.
Okay. And you just...
I thought she was a cocktail, and ask her what kind.
So you're a cocktail waitress, and hey, as a cocktail waitress, can you write this off? This...
I don't believe so.
You don't think so? All right, and what size did you get?
This just full C.
They're full C.
Mm-hmm.
And what's up with you that you're 19, you're so preoccupied with your breasts?
I don't know.
You sound kind of screwed up. What's wrong with you?
There's nothing screwed up about it.
Come on, baby. You know you're a mess.
No,
what's going on?
I just wanted to go bigger, and I didn't want to spend that much kind of money again.
I know, but let's just break you down for a second. Hold on, Marcel. You're 19 years old, right?
Mm-hmm.
You've already had breast augmentation at the tender age of 19, and you have a full C.
Mm-hmm.
Now you're already back on the breast warpath trying to go up another size.
Well, I would have gone D had I known that it wouldn't have been that much of a difference. I just didn't want to go that big in the first place.
Right, but what I'm saying is why the preoccupation? I mean, I understand.
It's something I'm interested in.
I see. So the preoccupation is because you're interested in it?
I'm
a second. Why are you so caught up in your physicality?
I don't know.
You have an eating disorder?
No, not anymore.
Yes, now we're getting somewhere.
Oh
What'd your mom do? Force you into ballet when you were young?
No, not at all.
What happened?
Quite the opposite. She's very conservative type, not into physical appearances at all, and actually gives me quite a lot of crap and grief for having an interest in mine.
Uh-huh. And what about your dad?
He's not an abuser. I know that's probably what you're thinking of.
No, I'm just no.
Never, paid a lot of attention to it either. I think I'm the only person who pays any attention to my physical appearance at all.
Uh-huh. You do any drugs?
No, not anymore. No, not at all.
What were you doing?
Oh, it doesn't matter. There's a few things, but it's been quite a while since I've touched anything.
A little speed, a little coke?
No, never coke.
No coke. Speed?
Yeah.
All right, baby. All right, so listen. You got a few things running around your brain, right?
Yeah.
All right. Why don't you focus on that stuff and spend a little less time on your jugs? Do you know what I mean? It's not going to... I guarantee, and I rarely say this, but bigger breasts is not going to solve any of your problems.
No, it's not. I mean, that's not why I'm doing it.
I know, but what I'm saying is you have a full C, you're 19 years old, you spent a lot of time thinking about external types of things, like what you look like. Why not do a little internal work? You had an eating disorder?
What my mother told me.
Yeah, yes.
Well, Mom's right in this case.
I know you hate your mom, but she may have a point here. You've had an eating disorder, you've had a drug habit, you've had a boob job, you're not even 20. Why don't you start focusing on, read a book, walk on the beach, get a little therapy, listen to some classical music.
All right, I'll do all of that.
All right, baby.
One more.
Now.
Is it safe to take the pills with the breast enhancement?
Yeah, I'm sure you're not risking anything.
Glad I made it.
Made a real impression on
I
her
made
there.
my point. Listen, all of you don't know what you sound like. I know what you sound like, because I'm sitting here listening to your ass all night long. And I can tell you that's a screwed up person. And I can tell you that any money wasted, any money that she puts into anything but therapy is a big waste for her. I guarantee she ain't going to be any better looking.
No.
I'm sure she's fine looking. I'm sure boobs are big. I'm sure her ass is tight. I'm sure guys love her just fine. And don't worry, that ain't your problem.
It won't help her.
No, it will not. All right, let's move on. We'll speak to Aaron.
Yeah.
You're 19. What's up?
My girlfriend, every time we have sex, she feels like she has to pee, but she can't pee.
Mm-hmm.
She's been to the doctor. We both got tested for gonorrhea and chlamydia, came up clear. Nothing positive. She's taking, I think it's called Merit for birth control.
Merit?
Yeah.
It's a brand of cigarette, isn't it?
No, it's like M-I-R-E-T-T-E, something like that.
It'd be nice if they had,
Merit.
Yeah, cigarette. I mean, for the smokers out there, why not? Put a little estrogen in there and let them get it, while they're at work. All right, so she has pain she feels like she's going to urinate when she orgasms.
No, afterwards.
While you're having sex.
Orgasms, she feels like she has to go, but she can't go, and it's painful. And she sits there, she cries afterwards. It's sad.
And it's tough for you because you just had an orgasm. You're watching Sports Center and talking to one of your buddies on a cell phone, and it's tough to comfort her when she's on the toilet.
Pretty much.
Yeah, I know. Women, let me tell you women something, too. You start crying all the time, and we stop paying attention. You watch a soap opera, you're crying. You're at a wedding, you're crying. You can't pee, you're crying. You're crying all the time. Eventually, guys just start tuning it out. It's no big deal. We see a guy cry, we freak out. You know what I mean? It really makes an impact because you never see him cry. But if you cry all the time, it doesn't mean anything. It's a girl who cried, cry. All right, so anyway, Aaron.
She tries the cranberry pills, I guess. I guess one of her friends told her to try those to help, but it doesn't really work.
Okay.
What could be the problem?
What type of doctor has she gone to see about this?
A gynecologist.
Okay.
And she doesn't know what it is.
And have you thought about seeing a urologist?
No, we have
Because that would probably be where I would go next. I mean, there's a lot of really good gynecologists, and they do a lot of the female surgery and all, but sometimes you need someone with just a little bit more expertise in just a smaller field like urology. And if she's having something to do with her bladder or urethra, she may need to have a cystogram. She may need to have someone look in there with a scope or do a dye study to see what possibly is going on in terms of her anatomy. Is there something about her bladder that is causing this ongoing problem?
Will he have to boink her in the doctor's office in order to simulate the orgasm?
No, the doctor will do that.
Oh, I see.
You got to have some perks in this business,
yeah. You know what I was asking Drew about? Maybe you could answer this. He didn't really have an answer. I was asking about the urology, and I said, if you're dealing, especially with the male phallus for a living, which has got to be a rough gig, there's a certain amount of problems that surround the penis that have to do with an erection, a Peyronie's disease, things like that. Does the guy have to get an erection in the office? Are there certain things you have to examine while the guy has an erection? And if so, that's got to be rough.
Actually, that's true. And if it's an erectile dysfunction and stuff, I mean, I know certainly some urologists in surgery, to properly examine it, they will, with the patient asleep, they will cause an erection by injecting saline into the penis.
Good times.
To cause an erection to see, what's going on.
I see, and then pose for pictures by it with the nurse and that kind of stuff. So they can cause an erection by injecting saline into it and
putting a little tourniquet at the base.
Little tourniquet at the base. Nice. I had to keep one of those saline syringes in my car just in case.
Just in case.
The situation arises, pardon the pun. And what about for like Peyronie's? Do you have to get to see if the penis is curved?
Well, in severe cases, it's curved even when it's not erect.
Oh,
so
really?
You can have an idea. You can feel some real thickening.
I see. Because I'll tell you what I told Drew. I would say, listen, if I was a urologist and I was trying to figure out whether the guy had a bent penis when it was erect, I would say, listen, here's a Hustler, here's some Lubriderm, here is a steno pad and a number 2 pencil. Now, you go get a boner, lay the thing down on the steno pad, and trace around it, like what kids do. You know what preschoolers do? They put their hand down, they draw around it, and they make a turkey. Do that. You draw me a banana, and you come back, and we'll see what we got. And please, don't draw any eyes on it or bow tie. Just bring the thing back, and then I'll go ahead and put the compass on it, and we'll try to figure out if it's Peyronie's or not. That would be my angle as urologist.
Or a Polaroid camera.
Oh, yeah. Oh, even better. Yeah, those exist now?
Yeah.
That's smart. And doctors have access to those, what were you calling them? Polaroid cameras?
Polaroid, yeah.
Oh, it's like magic. Ash?
Yeah.
You're 21. What's
yes,
up?
I am. I just want to tell you real quick that the Mormon missionaries in the Las Vegas West Mission absolutely love you, Adam, and we love your show.
Well, I'd like to give a shout-out to all my Mormon peeps in the Vegas area.
Oh, yeah, there's a bunch of us.
Sure.
I have a question. I have a kind of small wiener, and, I recently ordered these pills that are supposed to be all natural and all herbal, and I think you were talking about it just a second ago with another caller, but they're supposed to, increase your penis size by, 3 inches with no side effects.
Sure.
And I haven't got them yet, but I was wondering,
I'll sell you some of those.
Yeah.
You just send me a check.
Yeah, how much were they?
They were $59.95.
Right. Hey, Marcel, seriously, as a plastic surgeon and a man who wouldn't mind a few inches on his own dork, what do you think a pill would run if I was a company that produced this pill and I could guarantee 3 inches onto the penis?
You could name your
pill?
price.
Yeah.
You could name your price.
If it worked
with no side effects and you're all John Holmes afterwards, you could name your price.
Yeah.
I mean, that's,
I think we could start about 20 grand a pill.
Oh, yeah.
And eventually, in 5 years from now, you give them 3,500.
Yeah.
It'd be like a flat screen TV.
Right.
Eventually, the price will head down. But for now, it's going to be 10 grand.
I mean, Ash wanted to know if the penis enlarging surgery was such a great deal. I'll tell you, that's also a checkered kind of field in plastic surgery, and certainly there's 2 components to it. One, it makes your penis hang a little lower without actually really making it longer. It just hangs a little lower off your pelvis, so it looks a little longer. They cut the suspensory ligament.
Is it equivalent to taking your mailbox and pulling it out of your lawn just a little bit?
Exactly.
To make it higher?
Right.
Yeah.
And then the second part to increase girth is you can do fat injections around the shaft. You can put You can do dermal grafts, but those tend to make it look like more of a torpedo or a cigar rather than a real penis. So
I wouldn't mind singing a ship or two, though. I mean, well, what... okay, well, let me ask this. If you get a fat injection in your penis, does it have to be your own fat?
Yeah.
So where would they take it out of normally? Your butt,
belly,
your hip?
your belly, your abdomen, your love handles, wherever.
All right. So you could theoretically lose a little...
A win-win is what you're thinking?
Could you? I mean, could you
but
do
then
that?
you don't inject that much volume into the penis. You got to
Right.
imagine you're going to inject maybe a few cc's.
Right. Okay. So they take that area, they take some fat out, they inject it, and then does your body reabsorb it?
Most of the time it does, and you can get calcifications, you can get lumpiness. It's not a great procedure.
So this thing that was basically all the rage about 4 or 5 years ago has really settled down.
Yeah.
And people aren't really even doing that
No,
procedure
some
anymore.
people still do it.
They do?
Yeah.
I just haven't heard. There was one doctor who was doing a lot of it.
Right.
Probably out of Florida, I think, is where the guy was.
There's
I can't
also
remember
one.
where it
Yeah,
was.
there's also one here in Southern California.
And did he get sued? Did he go under?
I think there was a lot of medical legal issues.
I see. So it's really, there's just no free lunch in
No.
this department. And there's just no male equivalent to the breast augmentation when it comes
No.
to the genitalia.
No. I mean, that vacuum thing you were talking about may...
With temporary results, sure.
You know, may help, but...
Well, if you ever see the magazines, it's like they show the guy, and then they show the same guy with a boner. So it's like, yeah, he did increase a few inches onto his penis. Why? Because it's engorged with his own blood.
Right.
It's, yeah, I do that on an almost nightly basis. All right, we're going to take ourselves a little bit of a break here. Dr. Marcel is here, plastic surgeon extraordinaire, filling in for Dr. Drew, and we'll take a little break. We'll be back with more of your calls after this. Yeah, Loveline. I'm Adam Carolla. That's Dr. Marcel, the plastic surgeon, filling in for Dr. Drew tonight. Phone number 1-800-LOVE-191. Let's hop back on the phones, and we'll speak to Marie, or... Is that Marie?
Yeah.
You're 17. What's up?
Okay. Well, I have a quick question. I don't know, like, I have an eating disorder, and I don't know, like, what caused it.
Yeah, where you usually over-domineering mom.
But she's not really over domineering.
Yeah, she doesn't bug you. She's not too involved in your life.
Are you bulimic?
I'm, like, I don't know, I've had, like, a problem, like, I mean, I was just, like, I, like, stopped eating for, like, a while, and then, like, one of my really good friends died, and then it just kind of, like, triggered it, and and then it kind of turned into bulimia.
Hey, Marie, can you speak up a little bit, please?
Sure. Sorry.
Okay. So your mom didn't stuff you into ballet class when you were 3?
No.
All right. Well, what about that, Marcel? Do you think there's certain people that are almost like biologically predisposed
I think
to an eating disorder?
Some, and I think some of it's a chemical imbalance also. And once again, you know, I'm a big advocate for people getting into good therapy for something like this, and also seeing an MD to potentially be put on some kind of fine-tuning medication that'll tweak the brain chemistry a little and make them feel better about themselves.
So how about that, Marie? Can you see a doctor? Have you seen a doctor?
No, my mom doesn't know.
I know, but why don't you tell her? Can you tell her?
Yeah, I could.
I mean, if you're too thin, you know, it's going to affect your periods. It's going to affect your health.
Well, I'm not, like, you can't tell. I mean,
How much do you weigh?
like 128,
How tall are you?
5'8".
All right. Well, it's a little thin. But you're throwing up your food? Are you doing that?
Yeah.
All right. So you need to do something because, you know, one thing I've learned from this show is, other than the entire world is effed up, is that this is a real dangerous situation. That people die from this, and they ruin their teeth, they ruin their esophagus, and they do permanent damage.
Yeah.
And stuff that's really irreversible. And so you got to get on it now.
Okay.
All right, so you're calling us. You know you have a problem.
Yeah.
You got to get help.
Can you talk to a counselor or something like that?
Yeah.
All right. Well, you don't sound too enthusiastic about it. I don't blame you, but you got to... Here's the deal. You either have to stop or you have to seek help. It's one or the other.
Right.
And it seems like you're having trouble stopping.
I do. like runs my life. I swear that's all I think about.
Well, then you really need to take matters into your hands and get help.
Yeah.
All right?
Okay.
All right, we'll do that, would you?
Yeah.
All right.
Thank you.
All right. Jack,
Yeah, how you doing?
you're 25. What's up?
Yeah, well, I was just wondering about female ejaculation. I know it exists, but what is the substance exactly that comes out?
I'm going to let you handle this one, Adam.
It's the woman's soul, oftentimes, in a liquid form.
That's what I thought.
Yeah.
I figured as much. So it's okay to eat then?
Sure, if you don't mind eating a little soul. I guess they have some glands down there, and they can produce stuff, and I don't know, whatever comes out of a gland is what comes out of there. I don't think it's anything they need. You don't have to put it back in them. I made that mistake once.
I see.
It's very uncomfortable.
So it's not urine then, because it comes out the same hole, right?
No. It shouldn't come out of the same hole. If it does come out of that hole, then it would be urine. And if it comes out of the larger hole that's behind that, that'd be number 2.
There's another hole?
I should draw you a picture.
Would you?
So the point is this should not come out of the urethra.
Right.
That would be urine, and then some women have what you call female orgasmic incontinence, which means when they have an orgasm, urine comes flying out.
Okay.
I'd imagine it would be some sort of defensive thing. Much like many venomous snakes will shoot their venom at their prey.
Right.
This is something that's probably just some a holdover from the caveman days.
But that does happen. Is it actually urine? Is there like a watered-down version?
Well, it's not watered down. In some cases, it is urine.
Just straight urine?
Well, listen, if it's not urine, then it won't be half urine. It'll either be all urine, because it's coming out the urethra,
right,
or it'll just be some glandular secretion, which will not be urine, but you still won't want to eat it.
Right.
You
I
understand?
was kidding about the eating thing, but...
I see. Well, I'm just
curious as to exactly what it was.
we got a lot of young stone listeners who are thinking about it, Jack. I'm looking out for that.
Gotcha.
All right there, Jack.
Okay,
The aptly named Jack.
What's that?
All right, enjoy.
Oh, okay.
Yeah, good times, buddy.
Thanks.
That's all right. A fair amount of women do this, apparently. None that I've been with, actually. The whole orgasm theory is a little bit foreign to a lot of the women I've been with.
No rain women in your line?
No, have not run into them. And I'll tell you something, most guys don't mind it, though, because it's actually a sort of payday.
Kind of an attaboy? Doing a good job.
Yeah, it's a little Christmas bonus, like when the boss gives you nice bottle of brandy or a case of beer or something at the end of a good work week. All right, let's talk to Ken. Ken is 19. Ken?
Yeah, how's it going?
What's up?
You guys do a lot of good for a lot of people. Just thought I'd say that first of all.
Well, thank you, Ken.
Hey, I was wondering, me and my girlfriend have been together a little over a year now, and we don't have sex nearly as often as we used to. And I mean, we love each other to death, and it's starting to affect the relationship. I was wondering if you guys could provide any insight.
Who doesn't want to have the sex, huh?
Yeah.
I see.
Not as often, anyway. I mean, she loves it. We both have a great time when we do.
Yeah.
It's just,
Have you talked to her about it?
Oh, yeah.
What does she say?
Well, I try to talk to her about it, and I feel bad, because sometimes she gets real upset about it.
Mm-mm.
I mean, she says, she's trying to work on it, and I love her to death. I hate to bring it up, you know what I mean? But
Well, what would you like a week?
a week? I don't know, maybe
Once a week.
twice, maybe,
Twice, maybe 14 times?
Well.
I see. And what is she good for a week?
0.5 or so.
Right. So she's good for like one every 2 weeks.
How old is she?
She's 18.
And did this drop off?
Oh, yeah, definitely. I mean, we started a lot of relationships, I'm sure. We started having a lot more often.
Sure. Now, how long have you been with her?
A little over a year.
I see. And is there something up with her? Is there something in her past?
Not that I know of.
Well, listen, I hate to drop this bomb on you, but oftentimes, if you do a little investigation, you'll find out that there's something floating around, maybe that's coming to the surface now, maybe something she hasn't dealt with, something she didn't want to deal with. Is her family okay?
Sort of.
Yeah.
There was a
But would that
little
come
hesitation there.
Yeah, I mean,
Well, it's not perfect, but no one's is.
no, but some are sort of passable, and others are almost criminal. Is she? How's her dad? Does she like him?
She doesn't really talk to her dad too much now. She lives in another state.
I see.
But I mean, would this happen now as opposed to when we first started?
Well, here's the situation. Sometimes, and I'm not saying this is a situation with your girlfriend, but it's possible. Sometimes when people were sexualized a little too young or molested or sort of physically abused or there was some trauma, they get kind of hypersexual for a while. They have a lot of sex, and then they swing the other way and kind of shut down.
Yeah.
And that may be what's going on with your girlfriend. And it may be based on something that happened in the past. We don't know, and neither do you. But you have to talk to her and say, listen, if there's something going on, if there's something that needs to be worked out or settled or needs to be faced, I'll be with you, I'll hold your hand, I'll support you, but we have to do the work.
Yeah.
She's got to do something.
And a lot of women at 18 are still not in tune with their bodies sexually. And that comes certainly with time.
No, and I know. It's such a sad, sad tragedy. The time when you'd really like to, put a good tune-in on them, they're not in tune with their body.
Right.
Later on, when you're not interested in sex, they
all over you.
Yes, they're like Bangkok whores at that point. Very, very sad. I'll tell you, I have, and Marcel, you probably know this in your own life. There's many women who you've been friends with, maybe been intimate with, who you've known for a long period of time, who you've known since high school, who, when they were juniors, even seniors in high school, didn't even seem to care for sex.
Right.
Almost just went along with it, thought it was, something they had to do for their boyfriend. You stay with these women for a few years, see them in their 30s.
Oh.
See them in their late 20s. See where they went. I mean, half the girls I've known, and these are the ones I've known since, 9th, 10th grade, when you talk to them when they were 16, 17, talk to them about oral sex, disgusting.
Yeah.
Grotesque. Wanted no part of it. You get them around 34, 35,
bring it on.
That's right. You fall asleep, you better fall asleep with your hands over your lap. Something's going to happen. Absolutely. And women do change, and they do head that direction. And at 18, a lot of women are still a few years off, and maybe that's his situation, but I bet there's a little more floating around in the past that needs to be investigated. All right, let's talk to Sarah. Sarah?
Hi.
You're 18. What's up?
I've been dating this guy for about 5 months. I love him to death. He's probably listening right now. And he's Mormon. He's leaving in a week from tomorrow on a mission for 2 years.
Uh-huh.
And I'm having a really hard time with it. And he's sort of been like my crutch and my best friend and everything for the last couple months. I've moved out of my parents' house, and there's been a lot of stuff going on.
Yeah.
And
it's bad when you're...
Everyone tells me not to love him. Everyone tells me how I shouldn't be with him because he's Mormon and I'm not. But it just feels really right with him, and I'm just having a hard time with him leaving. I don't know what I should do about it.
I see. What are you, Wiccan?
No.
No. You practice Santeria?
I don't practice any religion right now.
I see. Do you guys have sex?
No.
And is that his decision?
It's a mutual thing.
I see. Why wouldn't you want to have sex with him, having no religion?
I respect him more than that.
I know, but if he weren't Mormon, you guys would be getting it on, right?
It's not like that, though.
But is that true?
I don't know.
Yeah, I'm going with yes.
It's not about sex, though.
It certainly isn't. You're not getting any. Now, Sarah, you said that you're using him as a crutch, which probably isn't a great thing in a relationship.
No, he's like my best friend, and I go to him with everything, and he's helped me through everything that I've gone through with my family. And
Right. But what's not going right for you?
Oh, I don't have any relationship with my parents, and I was working 70 hours a week, and I don't know, I feel really alone.
All right, and where's he going on his mission?
Brazil?
Brazil. Oh, that son of a bitch. We talked to some poor bastard last night whose mission was like Anchorage or something. Hey, talk about luck of the draw.
No kidding.
This guy's going to be in Carnival. He's going to be wearing a goddamn
not allowed to go
thong.
out.
Oh, no. Believe me, he's going to be on a thong, and he's going to be riding one of those like novelty bicycles in the parade, the ones with huge front wheels on it, and throwing beads to chicks who are pulling their tops up. Oh, that's horrible. And this guy's listening who went
He's only
to...
doing it for 2 years.
The guy went to Anchorage, just putting a gun to his head right now. He's listening to the show.
No.
I swear to God, a guy called from Alaska last night. He was on mission. All right, Sarah, when is he leaving?
A week from tomorrow.
Okay, you have 8 days to get him drunk and mount him and get him away from his Mormon religion. You need to soil him so that the Mormon church will not
Why
take him.
does everybody think that? My grandma came down and told me to have sex with him the other day in front of him, and I was like, "What are you talking about?"
All right.
No, it's not like that.
I see. Well, your grandma's a real piece of work. What a wonderful lady. All right. Hey, Sarah, he's going for 2 years. Hey, maybe you can go with him. What the hell are you doing? You're not doing anything.
I'm going to college.
You're going to junior college.
No, I'm going to Buffalo, New York to go to school.
Oh, that's not a school. What's over there? You're going to Buffalo. He's going to Rio. You're getting screwed. Go to Rio. What are you doing?
Do you believe you can love somebody for that long and not be able to be with them?
Well, yeah.
If it's meant to be, it'll be meant to be. You guys keep in touch, you're right, and when he comes back, if you still feel the same, then you have every reason to hope that you guys will hook up.
Well, put it this way. If he was going out there to just go on go to culinary school or something, you'd be done. Because he'd bang every chick in Rio. But if he's over there riding in a circle on a bicycle with a clip-on tie, trying to spread the good word to a bunch of drunken Rio de Janeiro's, you're in fine shape. All right?
Yeah.
But listen, why don't you go with him? You're not doing anything in Buffalo.
No, I can't do that.
What are you studying?
That's the hope. I'm going to do fashion design, hopefully.
No, please. You get more experience going to Rio than you will to going to Buffalo and watching a bunch of chicks in mucklucks and slickers. All right,
It's
Sarah.
hard for me because I feel like he's pulling away, and I know that's the whole point.
All right,
but-
listen, baby. Don't be so melodramatic. You have two choices. You either go with him to Rio or you go to Buffalo and you wait for him to come back. All right?
Whatever happens, happens, and I can love him anyway.
There you go.
You can love him anyway, but I'll tell you what. You don't have to worry about him because he's Mormon and he's on a mission. You're the one who's going to hook up with some dude at a kegger 4 months from now, fall in love, and this poor son of a bitch is going to come back in 2 years with tears in his eyes. I guarantee it.
No, I cheated on him, and I realized I don't want to be with anybody else ever. I know I'm young, but I don't want to be with anybody else.
You already cheated on him?
Yeah, I told him, though.
Okay. Oh, that's
No, there's a foundation to build a relationship on.
Yeah, let me tell you something. I hate to do this. This is the part of the job I hate, even if it sounds like I'm having a good time with it. But I swear to God, she comes from chaos. She's no virgin. She cheated on the guy already. 2 years is a goddamn lifetime when you're 18 and you're starting 2 years in college. Think about what 2 years was when you were in college. I mean, you were drunk most of the time.
Yeah.
But you still can remember some of those 2 years. And she's going off to Buffalo. She is going to hook up with some dude that she meets in some class. She's going to fall in love with the guy. And this guy's going to come back in 2 years and be freaked out. All right. We will take ourselves a break. We'll be back. Yay! It is the Loveline. I'm Adam Carolla. That's Dr. Marcel over there. Phone number. Forget about that damn phone number. Dr. Marcel, a plastic surgeon who's really fielded quite a few calls tonight, which just goes to show you that everyone is interested in their appearance. Yes.
If people tried to get through with questions about plastic surgery and you unfortunately didn't get to it, you can go to a website called imagemd.com. Happens to be my website, but I'm real good about answering questions, and if you're out of state, I'd be happy to try and hook you up with resources in your part of the country.
Well, that's very good. You give it one more time?
imagemd.com.
So there's where you can go, and you can actually communicate firsthand with Dr. Marcel. Darren?
Hey, what's up?
Hey, you're 24. What's up?
Hey, I was with been with my fiance for going on 3 years now, and she was having some pains in her pelvic, and we didn't know what it was. So we listen to your show all the time, and
Darren, speaking of listening to my show, stop listening to it now. Would you please turn that radio down?
there it is.
Well, I'm hearing something in the background. Now it's gone. Thank you.
You're welcome.
Okay.
Anyway, she was having pains in her pelvic area, and like I said, we listen to your show all the time. So I told her to go get it checked out, And they're thinking it might be cancer of the fallopian tubes. And my question is she still going to be able to have children, or?
Well, if it's cancer involving both fallopian tubes, or if it's a sort of cancer where they're going to have to take both her fallopian tubes and potentially her ovaries, obviously she won't be able to have a kid.
But you can have kids with one fallopian tube,
right.
But the kid will just have one arm and one leg, right?
Not quite.
I see. Fascinating. And you only need one tube.
Right.
Wait, let me, it's a part of life I try to avoid, which is the mechanical end of the vagina.
The business end?
Yeah, I'm like what women are with cars. They don't like to pop the hood.
Right.
Get their hands dirty. I'm that way with the vagina. I like to just sort of stand back, kick the tires a little bit. I don't like to get in there and, change the oil, pull the timing chain or anything like that. But the fallopian tube is where the egg comes down, right?
Well, you've got your vagina, which is connected to the uterus.
Right.
And then feeding into the uterus are 2 fallopian tubes.
I see, yes, the 2 fallopian tubes. And that would be like, if it was a water park down there, that'd be one of those slides.
Right.
And then where the kid would end up would be in the
uterus.
The uterus. Yeah, that's how that's a good way to teach kids about how the reproductive system works. The egg would be like the fat kid who's coming down the slide.
There you go.
All right, so he ends up in that little pool known as the uterus. And just as long, and that's where the semen,
correct,
which is like, let's say, like someone whacked off in the pool. Let's
There
say.
you are.
Okay, that would then cling to the egg, which is in the pool. But either way, as long as you have one, you can get an egg down there.
Right.
But if you have none, then what do? Can you get the egg
Well, if you
and
still have
implant it
ovaries,
in there?
right? You could have an in vitro.
What's that?
You could have it if the fallopian tubes are gone and there's too much scarring for the egg to make it into the uterus to be fertilized and implanted, then they could harvest eggs from her and mix it with your sperm and implant that. But
Right.
a lot is going to be determined by if this really is cancer, what kind of cancer it is, if she's going to have chemo or what.
All right, but here's the deal, Darren. The doctors will figure it out, and if one tube is gone, then you got the other. If the other tube is gone, then you can do in vitro. There's a million options these days.
Correct.
Okay, so you kids will be fine. I know you will. I know it'll all turn out fine. All right, let's talk to Kim. Kim is 32, married, and is having an affair with a 22-year-old.
Hi.
Yes. Is that true?
Yes, it is.
Mm-hmm.
How long you been married?
9 years.
Who's the 22-year-old?
He is actually one of the supervisors where I work.
I see. And by the way, that's a bad sign when you're 10 years older than your supervisor. That means that things haven't been going according to plan.
And fishing off the company pier.
Right. And does he ever tell you that your hat is not on straight or your smock is has secret sauce on it? No.
No.
What do you do for a living?
I work for a large company that does deliveries and
I see.
kind of like the postal service.
All right. Now, why are you cheating on your husband?
Well, for one thing, I do feel bad about it. For one thing, for another thing, he's done it to me. It's not a get back thing though.
Sure.
I'm not pretty good enough anymore. I'm not,
Is that what he says?
Oh yeah.
Okay. So,
And after a while, I mean, I'm one of those people. I hate cheating. Okay.
right. Now, I can see that.
Yeah. And
While you're boinking your 22-year-old supervisor. But do you have kids?
yeah.
No. How old are they?
I have 3 kids.
No.
Yeah.
That breaks my heart, baby.
Yeah, I know.
Yeah. How old are they?
13, 11, and 4.
I see. Well, they're almost ready to go out on their own. Hey, listen, Kim, and your husband, is he an okay guy beside not treating you that well?
Well, no, I don't think that's an okay guy. The verbal abuse,
I see.
putting down and all that.
All right, Kim, listen, we're fresh out of show. Let me tell you something very quickly.
Mm-hmm.
You have 3 goddamn kids. Do you understand me?
Mm-hmm.
You're a mother, first off.
Right.
You're a woman, second.
Right. Oh, I know this, yeah.
Yeah, I know you know this, but you got to start acting like it. Now, I'm sorry your husband's an a-hole. You shouldn't have married him, but you did.
Yeah,
Now, you were stupid enough to have 3 kids with this guy. 3 kids you're going to unleash onto society, and then they're going to be my problem. Now, here's what I want you to do. Break it off with this 22-year-old you work with, because this is going nowhere. Don't tell your husband about it, and demand that you guys get into some counseling, that you do some work on behalf of the 3 kids. Do you understand? On behalf of your 3 children. 3. All right, so they don't turn out like you. All right. What the hell was that?
I don't know.
Another drunken husband? All right, we'll take a break. We'll be back. Yep. Well, there you have it. Another fabulous episode of Loveline. in the ground. I want to thank Marcel for coming in tonight, Dr. Marcel, for doing a fantabulous job. And I really mean it. I'm impressed. You did a great job tonight. And it's just how it should have went. We got a bunch of questions that were right in your wheelhouse, and you hit them out of the ballpark.
It's always fun coming on. You guys have always been great.
Well, I do appreciate you coming in, and like I said, real nice job tonight. And give your website out one more time if people have more questions.
That's www.imagemd.com.
Fantabulous. All right. Thank you, Marcel. And until next time, this is Adam Carolla for Dr. Marcel saying mahalo.
This has been Loveline. The opinions expressed on this show are not necessarily